Hey guys, I wanted to talk to you about diabetes education class. It's something that I've been running for my patients for about 5 years now. And sometimes patients who have type 2 diabetes who are invited to the class after they see us in the first consult, they want to know why they have to come to the class. I wanted to say a little bit about how this came to be and why diabetes education is such a huge part of what we do here at ASAN. In 2011, when I was moving back from the US to India, I decided to certify as a diabetes educator, a certified diabetes educator by the American Association of Diabetes Educators. And my co-endocrinologists, my medical colleagues, were a bit surprised. They were like, "You're overqualified to train to be an educator. Usually that's done by dietitians, nutritionists, nurses, paramedical staff who are much less medically trained than an endocrinologist." And I said the reason I want to do it is because that's something between me and the patient, which in the US system, we prescribe for education and the patient goes and meets the educator and we're not aware of what exactly is happening there. And the doctor is basically in charge of the medication management only. And I felt that if I'm moving back to India, I needed to know what was in that middle section, because it would be very important for me to know how the patient should be educated, and then I would customize that per the Indian cultural requirements. So I came to India with that qualification, and I had been away from India for 10 years, so I wanted to do the education myself, also selfishly because I really wanted to understand the cultural psychology of the patient and how is diabetes managed in India, what are the educational gaps, the knowledge gaps in the patient's mind. And I started to really do that one-on-one most of the time for the first 3 years, from 2011 to 2014. And in 3 years' time, I had accumulated enough knowledge that I was able to put together a curriculum which, by the grace of God, I was allowed to deploy at Hinduja Hospital, which is where I was working at the time. And the management was very supportive of this idea. And I was able to now provide education in a group format, which had all the FAQs, you could call them, of patients in India not understanding how to manage their diabetes. Along the way, I had learned a lot from the patients about how to manage their food, the food preferences, the emotional reactions to being diagnosed with diabetes or being told that they might have to go on insulin. And I became very fond of educating the patients. So now with the group format, what happens is there's patient-to-patient learning also. It's not just me educating the patient. And in a group of patients, if somebody has a question and I answer it for them, then everybody else benefits. It's a mutual win-win. It's a three-way win, actually. So I continued doing that, and then when I started ASAN, I of course continued doing that here. We have the classes once a month, and I see the difference that somebody who has sat through the class and has type 2 diabetes, even 2 years later, they still remember the basics. And that's very powerful. It kind of makes all the difference if someone's going to be able to reverse the diabetes or not. Reduce medications, get off of insulin. People need to know what to do with their nutrition, their exercise, their overall lifestyle. Otherwise, doctors are just trained that diet and exercise is something the patient has to do, and then the doctor's training starts with how do you write that first drug? When that fails, how do you write the second one? And I am sad to say that we were only trained to look at the patient as when one drug fails, how do you add the next one? We were never trained in what to do when the lifestyle changes fail. Rather, it was somebody else's problem or somebody else's responsibility, and especially in India, it's not even standard of care. Not all patients get even a basic diabetes education from a paramedical staff, let alone an endocrinologist. So I've begun to see that it's extremely valuable. And I don't think any doctor went into healthcare thinking that, yay, I'm going to now become an agent of the pharma industry or an agent of the insurance industry. Most of us got into medicine because we had a desire to help patients heal. And somewhere along the way, we were trained to somehow react with pills and prescriptions to a chronic disease, to a lifestyle disease. And now that I think about it, it just makes me realize that how can a pill cure a chronic disease? It's only going to manage symptoms. That's what allopathy is. So the education piece becomes the way out of that loop, and our mantra has become better health with less medication through lifestyle change. I mean, which of you has met anybody who says, I love popping pills? I mean, no patient wants it either. So if no doctor wants it, no patient wants it, This is where diabetes self-management education comes in to fill the gap between that theoretical advice of eat less, move more, or change your diet and exercise. And some doctors were having good intentions. They'll say diet, exercise, but they're not trained in how to provide support to the patient for that. So yes, I did go out of my way and get trained in many things, not just the CBE certificate, but also the emotional, spiritual, behavioral, many things that I kept learning along the way to change my own behavior and then help my patients to change their behavior. So that's why diabetes self-management education is such an important part of how we manage type 2 diabetes, because it's a lifestyle disease. Once again, talk to your doctor about it, get yourself educated. If your C-peptide is high, that's what we look at, is to help people reverse their diabetes, and the foundation of that is education and knowledge. Take care, guys.